Well, hello there. My name is Lynn Weems. I'm a preventative healthcare practitioner and have been working in this field for 20 plus years. And I'm coming to you from a different kind of better clinic. And who is that? Who are we? We are me and our consultant physician, Dr. Tom, and hopefully you'll get to meet him shortly. So today I just wanted to talk to you a little bit about a vitamin that you probably don't hear too much about, and that is K2. So why do I want to talk to you about vitamin K2? I want to talk to you about it because I think it's something that gets missed a lot. And you may be one of those people that don't even realize that you're deficient in it. So what are some of the signs and symptoms that you're deficient in K2? Let's talk about a few of them. So some of them are easy bruising, frequent nosebleeds, heavy, painful menstruation, frequent bone fractures is one. Bone density loss can sometimes be caused by a deficiency in K2. Joint pain, inflammation, poor dental health. I'm trying to remember all of these. Prediabetes, and a horrible one, signs of premature aging. So those are some things that I actually think that you really need to take a look at and see if some of these are something that you're experiencing. So what would K2 be beneficial for then? Well, of course, obviously all the things that are a sign of deficiency. So bone health, big one. Cardiovascular health, dental health. It also helps increase or help insulin sensitivity, glucose metabolism. Another good one, helps improve skin elasticity, helps with joint pain and inflammation. Obviously the prediabetes and signs of premature aging. So I'm repeating myself a little bit here, but I think it's important that you hear it more than once so that you know how special this supplement can be for you. So what made me come on and decide to talk about something that a lot of people don't talk about very much? Well, I was actually reading a study. It was called the Rotterdam study. And in this study, there was like 4,800 roughly subjects that they studied on K2 supplementation. So what was the outcome of that? It was that the intake of the K2 compared to the lowest intake, so the highest intake people of K2 compared to the lowest intake people of K2 supplement, and this was a study done over 7 to 10 years, showed that there was a 57% reduction rate of risk of dying from cardiovascular disease, and their risk of having severe aortic calcification, which basically means narrowing of the aortic valve, was decreased by 52%. So I think that was a really good study. When you're actually using that many people, to me, that's a fairly good indication that the numbers are accurate. So that's why I decided to do this. So what are some of the conditions that will increase your risk of actually having a deficiency in K2? So that would be fat, malabsorption, celiac disease, inflammatory gut disorders. That would be things like Crohn's or ulcerative colitis, leaky gut syndrome, history of bariatric surgery, and one that a lot of people are doing lately, and that's a low-fat diet, which will actually increase their risk of having this deficiency. So if you decide to take K2 supplementation, when do you take it? Well, a K vitamin is basically a fat-soluble vitamin, so it's best that it's taken with food, and specifically best when it's taken with healthy fats, such as olive oil, avocado oil. Another one would be coconut oil. Okay, so how much do you take? I wish I could give you an absolute dose. A lot of studies have been done on K1 supplementation, but not on the K2. I can tell you that the one I take recommends if you're 19 and older that you take 120 micrograms if you're male and 90 micrograms if you're a female. So, but you would need to talk to your natural health care practitioner or your physician to make sure that that dosage is correct for you, dependent on your healthcare situation. Now, for me, I want to tell you that I feel that personally the best way to take K2 is with a vitamin D supplement. And fortunately for us now, they are creating a lot of supplements, vitamin D supplements, that actually have K2 with them. And it's best if you do take it that way. It has a better effect on your bone and cardiovascular health if taken that way. Keep in mind that vitamin D actually helps with the absorption of the calcium from the intestinal tract. And some research is actually showing that if you take vitamin D3 without the K2, that calcium may build up in your soft tissue and the arteries. So that's not good. So a lot of people taking vitamin D without the K2, and you know, we think that's a good thing, but we may actually be creating other problems as well. So let's make sure that we get it right. When should you not take K2? If you're taking anticoagulants, if you're taking antibiotics. So my advice to everybody is always, always check with your physician before starting any supplements. It doesn't matter what they are. You want to make sure that they're not going to be harmful for you. A lot of medications are contraindicated with supplements. So you want to make sure that you're following all the guidelines and that you're keeping yourself safe. So this is Lynn Weems. If you found this beneficial, if you found this informative, please let us know. Please let us know at A Different Kind of Better Clinic. You can find us on Facebook. We do have a Facebook page. And let us know what you think. And if this was helpful for you, if you learned something from it, we hope to bring you lots more of these. Thank you for tuning in. We sincerely appreciate it. And we'll look forward to you tuning in again in the future. Take care and bye for now.